My guest today is Dr. Rob Herron. He's a graduate of Creighton University School of Dentistry and is practicing right here in Columbus, Kansas. He's here today to discuss all aspects of the field of dentistry. Dr. Herron, welcome to the show.
Thanks for having me. Glad to be here.
All right, we got a lot to get to. First of all, let's start with your credentials and the extensive training that you've gone through to get where you are today.
Well, sure. Of course, graduated Columbus High School in 1981, Pittsburgh State University, here local, in 85, and then Creighton University School of Dentistry in 1989. And then from then on, you know, a lot of continuing educations to put emphasis on other things in dentistry.
Right. Do you love being a dentist? Do you love
absolutely,
what you do?
yes. Yeah. We love it. Love it.
All right, cosmetic dentistry these days seems to be more popular than ever, what with extreme makeovers, and everybody wants to have a celebrity smile. Do you find that in your practice?
Well, sure. Everybody likes to be pretty or look handsome, and a lot of it has to do with your smile.
Right.
That's where people look. They look at the eyes and the smile, the teeth. And so we find that being a lot of patients' desires is because the decay is being reduced. We're really the only profession that's trying to put ourselves out of business. You know, because we're trying to get rid of decay, trying to get rid of periodontal disease. And what that leads to is that people then are able to look at other things such as the cosmetics and how their smile looks.
That's true. That's a good. I never thought of that. Yeah, because decay has dropped over the years.
Tremendously. Fluoride and better oral care and knowledge. Absolutely.
So besides the beautiful smiles that you create in your office, what other kinds of services do you offer?
Well, we're a general dentist office. We do most general dentist services. We use tooth color fillings for the most part. Pretty much anything that needs to be done.
Yeah, I think mercury fillings are sort of gone the way of the dinosaur.
Passé, yes.
Yeah.
Well, it's basically the difference between do you want a black filling or do you want a tooth colored filling. There are some places where there's not a choice, usually in the back and where we can't get it dry, or for some reason we can't get our light in to set the tooth colored fillings, and we still, a very, very, very small percent, we keep the silver colored fillings around.
Yeah, right. What's the most popular procedure that you perform these days, do you find?
Most popular number-wise is probably very simple, small, tooth-colored fillings. You know, right in the top of the teeth, we use an instrument that helps us determine when the decay is there very early. And so number-wise, the most popular is very small, tooth-colored fillings just in the top. As far as popular for what the patients like, it's going to be something along the lines of Invisalign or whitening for life, where we do the brightening of your teeth.
All right, now this is a bigger question, and I know we don't have enough time to cover it, but there is a true correlation between your oral health versus your overall health, right?
Yes, absolutely. And more we're finding through studies, various studies that are done, is that the bacteria in our mouth have a high affinity for the heart. We pre-medicate patients that have certain heart conditions because of that. And what's being found is that more and more there's correlations. They're still trying to nail it down as to, does this cause this or is this because of this? But it's enough that I get concerned about it when I see the periodontal disease, the bacteria that's in the mouth that has the potential to be associated with heart disease, heart attacks, strokes, a lot of different things. What I tell my patients is that if you had the same type of inflammation and infection on your hand or arm and you looked down and you saw that, you'd go, oh my gosh, I've got to do something about that. Well, it's hidden in the mouth, and a lot of times there's no symptoms. And so when you have periodontal disease, you have an area of infection and inflammation, and you're packing food, and there's bacteria. You know, I say if you had a big long mark on your arm that you packed food into and back, you'd go, oh my gosh, I've got to do something about that.
Right.
But it's hidden, and there's, like I said, there's not a lot of symptoms, and so that's something that we look at and we try to explain that to patients, and there's a lot of treatment that can be done to take care of that, to arrest it, to stop it. You can't reverse it, but you can sure shut it down.
Now, explain what a typical consultation in your office looks like, just to put people's minds at ease.
Okay,
Yeah.
It's very simple. It's very easy. You just got me and a lot of times an assistant or one of our hygienists. It depends on how we bring you in. Most of the time we bring you in with the hygienist. You do the cleaning that day, but sometimes, you know, if it's more of an emergency situation or you just want to find out what's going on, we'll bring you in over on my side of the building and we'll look and take the necessary x-rays, see what's going on, and then we can just sit there and tell you, you know, what your choices are. And that's what it's about, is the choice. You know, we're not going to sit there and dictate that this is what you do. I always try to have at least 2 options. So, you know, many times we have many more options than that. And it's, you know, like it's from the Mercedes down to the Yugo, I call it. You know, you can pick what you want. And that's what's important, is that the patient know all of their choices and then allow them to make their decision.
Now, you offer something, the 24-hour emergency service.
Yes.
I mean, that's not something that you really hear of anymore.
Well, what we do is our 24-hour emergency service is that if you call our office and you need to get in, is that we will see you within 24 hours. And of our, you know, if you call on a Friday afternoon, it's going to be Monday, or we'll try to get you in that afternoon.
Right.
You know, if someone's in pain, we're going to stick around or we're going to come in. I mean, a lot of offices just don't have that, and I thought that was very important because that's how we would want to be treated.
Right.
You know, a lot of times we can bring someone into the office and say, oh, that's okay because it's this, this, and this, and fears that they've allowed themselves to have because it is the dentist. You know, we're able to allay some of those fears to where, okay, this is fine, I'll be fine, and it takes a lot of their concerns away just by being seen.